Hi, I'm Susanna Solstead. I'm the director of the Long-Term Care Ombudsman Program at the Senior Source. The Ombudsman Program is both state and federally mandated to advocate for the quality of life and care for individuals who live in nursing homes and assisted living facilities. Ombudsmen work on behalf of these residents to protect their health, safety, welfare, and rights. And we do so by making regular, unannounced visits to each of the facilities where we go room to room, talking with the residents about their care and working to resolve complaints on their behalf. In our program, we have certified volunteer ombudsmen who serve the frail, vulnerable elderly living in Dallas County nursing homes and assisted living facilities. Many of these residents never have family members or other visitors who come in to check on them. So these volunteers often are the eyes, ears, and even the voice for residents who are unable or afraid to speak up for themselves. To become a volunteer with our program, individuals first must be screened for potential conflicts of interest and complete a criminal background check. To become certified, volunteers complete 36 hours of initial certification training and then each year complete 18 hours of continuing education to maintain their certification. One of our volunteer ombudsmen has been working with a resident at her assigned nursing home for about a year now. When the volunteer first met this resident, the resident was very quiet. She often didn't want to talk because she was angry about having to be at the nursing home. The volunteer was very patient with her though, and she continued to check on her each time she was at the facility, and she started encouraging her to think about attending some of the activities there at the facility. Over time, the resident started opening up to the volunteer, and she started sharing some concerns that she was having with her care there at the nursing home. With her consent, the volunteer started working on those complaints and was able to get them resolved for the resident. Recently, the volunteer went in and, as usual, checked on the resident, and she noted a marked change in the resident's demeanor. She was happier and she was excited to tell the volunteer about some of the activities that she'd been attending and about some of the friends that she had recently made. The resident went on to tell the volunteer that because of the volunteer's consistent presence, her encouragement, and the work that she'd done to resolve her complaints, the resident's life had changed for the better. That's just one way that volunteers are able to impact the lives of some of the most vulnerable, frail individuals in our community.